Good morning, everybody. It's so good to see so many of you that I've known and some new faces. It's wonderful. It's always great to be with your group because I live in Abington. In fact, Nicole and I are practically neighbors. So, I have my heart goes out with Harford County and all the things that we're trying to do in Harford County for the people we serve, as well as the other counties. So today I know that all of you are, you're professionals, you've worked with us for a long time, or even if just for a short while, you certainly know a lot about us. So I'm not going to spend as much time talking about our programs and services as much as maybe some updates of things that you might not have heard. There we go. So we came up nationally, we came up with some strategic objectives. And these are the ones that we are looking at, and we call them pillars. And these are the 5 pillars that we are looking to really focus our time on. So it's increasing that concern and awareness, advancing our public policy, enhancing our care and support, and accelerating our research and growing our revenue. And actually they're talking about adding a 6th pillar, which would be about working with diversity and inclusion. We do that anyway, and we have mechanisms and committees and things that are working to enhance that piece. But I think they're actually going to make it a pillar if they haven't already. Which is a very important one. And I know you know that we work with people. We're all about people and science. But I wanted to show you why our logo is what it is. Because you see the person's head, which represents the people, and then of course the beaker for the science. So now you know what those little squiggly things mean. And that's us in a nutshell. And a lot of times people want to know, well, where does our money go? And so one thing to know is that it is shared between the local efforts as well as the national initiatives. And actually 58 cents of every dollar stays local. And I think that's very important for people to know, because that goes right to the service of the families and people that we're serving and that you're serving. And it helps with our support groups, our care consultations, education, and then our 24/7 helpline, which Nicole mentioned. And these are important things, and we offer all of these free, and we're able to do that because of the money that we keep for the local services. And then collectively with national, of course, that's where we're funding the research and the online resources. They have really increased the training and things that you can get online, which I'm really glad about that. Our advocacy efforts, and then other things about our concern and awareness with advertising and such. So these are the things that fall under care and support. And I'm just going to briefly go over those again. Our helpline, Nicole, we can't stress this enough for people to call this number. And I train the first responders, and I'm always asking them, to please keep this number in mind. And I also invite not just people that are caring for somebody with dementia, but professionals can call, the policemen and medics can call if they're in a situation and they don't really know how to handle it. Then they can call and get that some guidance for that situation. So it's very important to know that absolutely, when we say anybody can call, that means anyone can call. Our support groups, we typically have about 60 in Maryland. Right now we have about 36. that is active virtually. And I hope that will increase, because at the beginning, when we went virtual, we didn't know how long this would be going on. And so some people were saying, oh, let's just ride this out for, maybe a couple of months. And so now we're going on, much longer than that. So we're hoping to get some more of those in, but anyone can join any of our virtual ones, which works out great. The same for educational programs. We have a flyer that goes out every month to show our educational opportunities for that particular month. So if you would like to begin to get that, just email Nicole and she can, pass it on to the ones who need to know that, so that you can get that and share that with your families and people that you work with. Care consultations, we can do those over the phone or by Zoom, whatever people want to do. But it actually, I call it free counseling, but it's very limited. It's when we can meet with, I've met with as many as 18 people, some on the phone from different areas of the, different states, and then in person at the same time, just trying to get families on the same page with what's happening and educate them and look at next steps that will be best in the care of the person. So that's what basically care consultations are, is to sort of help begin that support and begin to help them with knowing sort of where to go at that point and as they go through their journey. Then we have Medical Alert. And that is, as you know, about 70 or so or more percent of people with dementia will wander at least once. And so we have this wonderful bracelet that people can get. It's a bracelet or pendant. We also let the first responders know about this as well, so that if they come up to somebody that appears to be wandering, they can try to look for that bracelet or pendant, and then it has an ID number and a different 800 number. And then they can call that particular 800 number, give the ID, and all of the person's information will pop up, who their caregiver is, address, medical conditions, all of that. So it's a great thing. The other wonderful piece to that is that the caregiver can also get it. And then in case something happens to them, such as if they are in a car accident, or something like that, and they wind up in the hospital, then people know that they're caring for somebody that is memory impaired, and they can go do a well check. And then our early stage programs are still going on. We have our early stage support groups, but then also on Fridays, we have what we call Fun Fridays at 11 o'clock. So I'll be going to that after this. Today will be our Finding Our Rhythm with drumming. And so we do the zoo and the museum. And I'm very pleased to say that with Catherine, with the Bel Air branch of the library, she had been helping us in person with Books and Beyond, and she was doing a fantastic job. And then COVID came, and then we had to figure out. So long story short, we will be soon starting back Books and Beyond virtually. So we're very excited about that. And of course, we advocate. Some of you go with us. We go to Annapolis, we go to Washington. Not sure how they're going to handle that this year coming, but I know that they will still come up with a way that we can be in touch with our representatives. And, I know you've heard this before, but, we are very, very fortunate that we are supported on both sides of the aisle. And this is one of the few things that our representatives are in agreement with. They're seeing it, and they're beginning to tell their story about a loved one in their family. So, it's powerful when they unfortunately are dealing with it, but they really see the need for what we need to do. We also advance our research, and because of our wonderful development team that have our walks, and we have our longest day, and then we have our memory ball gala, those kind of things. That's what keeps us going with being able to provide the programs that we do, and also the research endeavors that we have. After the federal government, we are the next largest funding source for research. And I just think that's incredible, given that we are a nonprofit organization. And then we have Trial Match, and I really, what good is money if we don't have people to go into the studies? And that's also something we're really trying to push and get more people to be a part of Trial Match. We already have about 350,000 users that use the service of Trial Match, with about 300 plus studies at more than 500 locations. And what Trial Match does is, let's say, I think the last number I heard is that there were about 19 studies going on in Maryland, because we have incredible places. We got Hopkins, University of Maryland, and so many other places that are doing a lot of research. And we're right here at NIH, basically. So, every study has their list of questions, and you have to see if you qualify. And so I can tell you, if I started down that list of 19 and I started answering questions, and only to find out at the end of the questions I'm not qualified, maybe I might get through 3, phone calls, and then I would be frustrated. And I don't know if I would even continue. Trial Match takes all of that out for the person. They answer one set of questions, and then Trial Match will literally match them with whatever they're eligible for and qualify for. So it's a wonderful, wonderful service. And then we have our Alzheimer's Association International Conference that's every year. And normally they have, I think, about 3,000 or 4,000 that come, and they come from so many countries and everything. This year it was virtual, and they had like 60,000 people that came, and so many more countries, because it was so accessible. And also, we had more volunteers, and we had more staff that could be a part of it, because it was free, and it was right there for us. But it's amazing to see the number of researchers and people, scientists that are coming together and sharing their findings and putting them together. It's not like, okay, China's doing this, or UK's doing that, and US is doing this, and we keep it separate. We bring all of this together because we're on one accord globally, which is just amazing. There's exciting things going on in research, so that's what I wanted to kind of, on the last part of my presentation, let you know. Globally, the Alzheimer's Association, we have invested $165 million over, like we said, 500 plus projects. It's actually close to 600 now, in about 27 countries. And we feel that at some point, when we get to the real therapy that will help Alzheimer's and other dementias, it's going to be a mix of our lifestyle interventions as well as the medicines. And they have even been talking about, regarding the medicines, that it's probably going to look like a cocktail, like when the cocktail was started with HIV years ago. It will maybe look similar to that. So there's going to be a mix of things that will come together for the therapy or the treatment of Alzheimer's and other dementias. These are the things that they're looking at right now. Of course, we always hear about the amyloid beta and tau. We're hearing a lot about the environmental aspect, how the environment is affecting us. We're doing a lot of sleep investigations, and all of these others, but these are the ones that I'm really hearing so much more about. And then we also hear about genetics a whole lot. But that's a lot of areas in which we are looking at, and our research is based on. And also we're looking at, we all know, because anybody in our group right here that works with people with dementia or families that has dementia, at some point there may be some behavioral issues, and or they may have the psychological, like with the hallucinations and things like that. Very real, and it really does hinder their quality of life. So we've got clinical trials focusing on those kind of things, like the agitation, the sleep disturbances, and psychosis and apathy. So we're very excited that there is some research going on regarding these types of behaviors in dementia. One of the exciting things too is they're looking at blood biomarkers, and it's coming. It's not, like I put at the bottom, it's not happening tomorrow or Monday, since today's Friday, but it's really already there in the clinical studies. And that will just be amazing that somebody can go in and get a blood test and will know if there is the biomarkers in their blood to show Alzheimer's or even other dementias. So this is a very, very exciting part, because right now, initially it was just an autopsy that could be done to really determine what, if there was Alzheimer's, in the person and affecting the person. And then they have gone to spinal taps, which, those are rough, but, it is a way that they can see the protein in the spinal fluid, which is pretty amazing as well. They're also, besides the blood test, they're looking at eye exams. And this is pretty cool too, in which they're learning that the tissue around the eye looks differently with people with Alzheimer's or dementia. So again, these are just amazing things that will be ways to detect Alzheimer's or other dementias in a very affordable way compared to what it is at this point. There is a study called the Sprint Mind Study, and it's the first one to actually demonstrate the reduction. And this was very exciting, and this took on a whole new level when people were excited of at the Alzheimer's Association International Conference. In fact, you see how many people they had. They had over 9,000 people that were a part of this, and they were monitoring their blood pressure. And they went down from the 140 to 80, which was the standard, to 120 over 80. And it was amazing to look at the reduction in risk for MCI and dementia. So it was so powerful that they stopped the study, because it was clear very soon when they started. It was very clear that needed to happen. And they even paired with the, I believe it was the Diabetic Association, and maybe some others, but definitely the Diabetic Association. And now the 120 over 80 is the standard of what we say it should be normal. So that was very exciting to see and hear.
Yolanda,
and why is yes?
One quick question. Is the eye test part of the photo they take of the back of your eye during an eye exam, or is this sort of something that's still coming?
It's still coming. It's still coming, because they're trying to see exactly everything they're looking at. And I don't want to tell wrong, but my understanding is somehow the tissue, it looks different. And I think it might be thicker or something, but there's a way. And that's what they're still trying to study, in that difference of what it looks like, if that's purely from something else, or is it, for dementia, or, what have you. So they're really not using that yet as a way to pinpoint it, but that should also happen soon, just like the blood test. Good
Great,
question.
thank you.
So why was this important to study the blood pressure deal? Well, those are things we can do right now. And it's so important that we begin to immediately take that opportunity to just make our life different. I hear some people say, oh my goodness, you talk about this healthy lifestyle, and I'm, in my 60s, I'm in my 70s. It's too late for me. It is never too late. Yeah, it would have been better if they had started younger, because maybe they would have reduced their risk even more. But you know what? It's still never late, because they will still get some benefit from it. So we need to encourage people to make those changes, no matter how old they are. And then there's a U.S. Pointer study. And this was a 2-year study, and it was self-guided and also structured. They had 2 groups, and there were 2,000 participants ages 60 to 79, and they were looking for people who exercise less than 3 times a week, and had other risk factors, like maybe high blood pressure or high cholesterol, things like that. And this is the first study in a real large group of this magnitude, of this many participants in the United States. And actually some other countries, like UK, have taken on this same structure. They're following the same format, and they're called the fingers. Isn't that funny? The U.S. Pointer is U.S., and the finger study is other countries. But it's, like I said, it's set up that way. So you see what it covers. You see the people down there having conversations. So that's about the stimulation. And that can either be through brain games and things that we've talked about before, but just conversation is huge. And the socialization, which I know we have definitely seen, I'm sure you've seen a big change in people as we have been going through this pandemic. We have seen so much deterioration with people with dementia from early stage on, in their cognitive, the cognitive decline. And then of course the healthy eating, healthy diet, and then the exercise, and then they are to self-monitor their heart rate. So those are the things about this study. Now, this is very interesting. We have something called Part the Cloud, and it was created in 2012 by Mikey Hogue, and they have raised actually $60 million and funded 55 projects since 2013. And 20 million of the 60 came from us, from the association. Yay. And it is the largest nonprofit research program, and it is the Alzheimer's Association Part the Cloud. So it's our initiative of getting more money. And so we have actually gone from 30 million, which is what started, now to 442 million. The awards were designed to give to people, researchers, it was a high risk research and high reward research. And, NIH and some of these other places didn't want to take the risk. And we do. We take the risk of, maybe it's a brand new researcher and they haven't really done much. And they're taking what they've found in the lab down to, into trials, and then hopefully some therapies. And they support the early phase of the studies. And that's important because that's not a lot of organizations will take on that risk. But like, again, I said we did. And we have actually had a lot of people come out of this. And we took the risk on those researchers and have come up with wonderful things. In fact, the researcher that came up with the PET scan that now shows, the beta amyloid, he came from us funding him. So it's very important. And just to give you an idea, it takes $5 million to go from concept to just phase 1. A lot of money. So after we started the money rolling, then NIH followed up, and then this is where the federal government kicks in. But the NIH had given another $259, and then in FY20, Gates partnered with Park the Cloud and started out with a $10 million initiative. And so there's 24 million from this partnership, and that's his along with ours, has funded an additional 16 projects. And it's very exciting. And they're looking at the immune system and inflammation. That's kind of a new thing that we're doing now. And it may be that we're going to be looking at some type of therapy about the immune system. So NIH is expected to spend $2.8 billion in Alzheimer's research in 2020. And we know that if there is not a cure by 2050, the government, we estimate, could spend $1.1 trillion. So that's why it's so important that we're trying to get this as soon as possible. These are just some other things that Park the Cloud is looking at through their research, is how the brain cells use the energy and the fuel, and the brain cells remove the waste and debris to avoid that protein clumping, and then how the blood supply in the brain is maintained. And then here's this drug, and I'm going to say it only once, if I can get it out then. Aducanumab. That's pretty close. Aducanumab. I can only do it in little, I can't put it all together. But anyway, you get the point. And I'm sure you've seen that name. So there's a story behind this drug. This is the closest that we have been. And this is an exciting drug for us because at this moment, the FDA approved drugs that we have are only to stop or slow down the progression of the symptoms. This is the first and only drug that is to stop or slow down the progression of the disease. And that's huge. But in 2019, Biogen is the one who has this drug. They discontinued phase 3. They were already in phase 3 after they showed that it didn't seem to be producing a meaningful benefit, because they were really looking at different levels and different stages of the disease. But they came back, and there was a emerge trial, and I can't tell you what that really stands for. But anyway, they found that some of the findings were indeed meaningful. And so there were several hundred people that were put on the highest dose possible at that time for longer periods of time. So Biogen pursued the FDA approval based on the results that they had, because they had revealed that there was some reduction in the cognitive functioning of the memory and cognition and language and the ADLs in people with dementia. I mean, it was showing some good things. And it showed it in the early stages, though, is where it really showed to be beneficial. And that is why we really push early detection, because this is where we need to be. We need to get people, diagnosed much earlier than we do. We're getting better, but we really need to keep pushing on that. But the latest update is it was the advisory committee had a meeting for 7 hours the first week in November, and they discussed the findings. I mean, they tore them apart. Well, you can imagine, for 7 hours. But the important thing too is that they heard the stories, just like we do in Annapolis and Washington. They heard the stories from those that participated in the study. So they did not approve it to continue on to be approved from FDA to FDA, which was very disappointing to the association. But they do have until March to make the final decision if they're going to approve it or not. We tried to convince them that if they don't approve it by March, then if we have to go into additional studies, it's going to be another 4 years of additional studies before we can have anything produced to be able to come back to FDA and get it approved. And the association's take to them was a plea that we don't have that kind of time. We just don't. So hopefully, as they continue to look at this between now and March, and they really take on and listen to the stories, because it really did help a lot of the people, we'll see what happens with that. So y'all keep your fingers crossed and pray and do anything else that you do to hopefully we'll get good news. So we know that if we can delay the onset, if we can find that treatment by 2025, because that's been our goal all along. And let me tell you, we're getting closer to 25, aren't we? It won't be long. So we hope to develop a treatment by 2025 that will delay the onset of Alzheimer's, even just by 5 years. We will save 5 million people from developing Alzheimer's. Wouldn't that be amazing to be able to save that many people if we can just delay the onset by just 5 years? So as I end, again, we continue to provide care and support for those that we serve, and definitely bringing hope to the future. As we have the white flower now, is for our first survivor. And I look at, Alzheimer's is all in my family, vascular dementia, you name it, different things. And I know I'm at high risk. But you know what? I'm not even thinking about myself. I mean, it'd be nice, but I'm not thinking about myself necessarily for the cure or delay for me. I'm thinking more about my children or my grandchildren, that maybe that little girl that's in that picture holding that white flower will not ever even have to really understand what Alzheimer's is. Wouldn't that be awesome? To not even know what that word is and what dementia is. That is my wish. That is my passion and my desire. So thank you so much for listening. And I'll turn it back over to you, Nicole. I'll stop sharing.
I was going to say, if you want to stop sharing, I'm going to go ahead. You should be able to unmute yourselves. If you want to ask a question, I do see that we had somebody put in a question from an insurance point of view. If someone does the blood work, which shows a marker, won't that make life insurance, long-term care insurance, and health insurance policies either impossible to get or vastly expensive?
That's a good question, and that's something I really don't know, but it's very possible. But then even with people that get MRIs now or PET scans, I mean, it's still doing the same thing. I haven't really heard anybody say, maybe not enough people have done that yet for us to really hear how it has impacted insurances. I'm hoping it won't, but it might. I don't know.
Yeah, I
But
mean,
that's a
that's a
good
great
point. That's a
question,
really good point.
Cindy. And, it also just points to that need to look at, Alzheimer's and dementia, as well as a lot of other diseases, in the context of the impacts beyond the disease itself. It's insurance, it's facility care, it's all of these different things that we have to kind of wrap our brains around and say, how long, how do we get that?
Yeah, because if you look at, and we have predictions of, when we have our facts and figures that come out in March of every year, it gives the amount that Medicare dollars and Medicaid dollars that go out. So I would hope that they would look at, especially health insurance policies, I would hope that they would look at that, and maybe even long-term care ones. And life insurance too. I don't know. I would hope, like you said, they would see the bigger picture, and that we would be spending less on their care. Yeah.
Yeah. Anyone else have any other questions for Yolanda? We will be sending out this presentation, as well as some links. And I did put in the chat, if anyone is a science junkie, because I do know there are some here, we do have an app that I think it's called Science Hub.
It is. It's called the Science Hub. Let's see. I probably can't show it
And
with this.
Yeah. I'm going to send out the
thing.
link. You can download this app, and it will give you a lot of that information, very timely.
Yes.
That Yolanda had shared. And it's, as we get more information, there'll be alerts and different things like that. And Yolanda, do you mind sharing quickly about the presentation that you've put together that you're doing over the next couple of weeks?
Yes. I had a request to speak to a group about the holiday, finding joy as being a caregiver in the midst of COVID and holidays. So that's a mouthful. And so I did put one together, and it's been well received so far. I think I've presented it 3 times already, and I've got probably about 6 more that I have between now and into December. But if that would be a topic that you would be interested in, and you would like for me to present to staff, or if you have a group of caregivers that you would want us to present virtually, I will be more than happy to. Or if you would like for me to share the PowerPoint and let you review it to see if it would be something you would be interested in, I would be more than happy to do that. Thank you, Nicole.
Yeah, I just want to, and that's sort of a nice segue into our December meeting is going to be talking about mental health. And so we know that the holidays, particularly this year, are going to be challenging for a lot of people in a number of ways. So we're just trying to kind of provide some resources to help people figure out how to cope with this, this continuing isolation, and the fact that we seem to be sort of stepping backwards a little bit in terms of our ability to be able to have these physical connections with people, that we're back to much more virtual connections, and just sort of ways to manage some of that. So, and that's information for ourselves and for the people that we serve.
Absolutely.
So we'll be sharing that.
And it was very interesting, the times that I have, shared that presentation. I'm telling you, we had incredible discussion about the feelings that the people had about COVID, down to anger about people not being, compliant with wearing masks and things like that. I mean, it was an incredible, just on that piece alone. So it really showed me that people wanted that time to be able to talk about how they feel about it, much less how it has affected their life and everything they have to do, but just how they feel about it in general. And one said, I'm not going to lie, I am scared because I am afraid of the unknown. And we all as human beings are. So I'm just saying that to say it prompted a lot of great discussion, things that we stayed on that much longer than I thought we would, but it was okay because they needed that.